Hey there, it's Sherry from Twin Sisters Mastectomy Boutique, and happy Canada Day. I'm going to take this day, Canada Day, to highlight some of the really good things about our healthcare system here. So one of the great things is that we have something called universal healthcare, which means that we're not paying out of pocket if we have surgery or we see our doctor or we get a bone set or anything like that. As long as it's like needed, like cosmetic surgery, yes, we do have to pay for the procedure, but pretty much everything is covered. And that is a huge relief. I can't imagine what it must be like to not have that as part of our healthcare system. Let me know where you are in the world and how your healthcare system works. Also, for breast prosthesis and mastectomy bras, most provinces and territories have some sort of government grant for a partial coverage for your prosthesis and sometimes your mastectomy bras. Here in Ontario, Toronto, Ontario, Canada, we have probably the lowest reimbursement, but at least it's something. It covers about half the cost of the breast prosthesis and no mastectomy bras. But breast prosthesis and mastectomy bras are considered medical devices, so you can put them on your income tax as a medical expense. And I'm not an accountant. I don't know exactly how that works. I think you have to have a certain amount. I don't know. But I know that I had a colleague when I was in a corporate environment, and she was American, and she had a lump in her breast. And our company insurance, as she was an American, and she was working in the US, we were just together for a meeting, covered the initial screening about this lump, but they said, well, we think it's okay, but in order to be 100% positive, you need further testing and a biopsy and blah, blah, blah. And that wasn't covered. And she said, Sherry, thank goodness we got a bonus because it cost her about $3,000 for the further testing just to find out that she was fine, which thank goodness she was fine. But, you know, that's really stressful. Now, in Canada, I read somewhere that even though we have universal health care, it costs the average person $33,000 a year to have breast cancer. And that's in, you know, lost wages and transportation and all the other things, expenses that come along with it, because that's just the reality. So that's very expensive. I can't imagine what it would be like if on top of that you had to pay for your treatment or choose, can I afford treatment? Like, how does that work? Let me know in the comments down below how that works in your country, because I am blown away by that. I have family in the UK, and it seems like they have universal health care as well. I don't know. I know in Canada, we say that we don't have a two-tiered system, but we actually do. You can actually, if you're an executive or you're willing to pay high prices, you can have a different level of health care, and it's faster and you can get into things quicker. You're not supposed to be able to do that, but it's the reality. But anyway, I am very grateful for Canada's healthcare system, and now they've implemented a dental system. So very happy to be Canadian and celebrate Canada on Canada Day. It's our birthday. Happy Canada Day. Don't forget to like and subscribe, share, comment down below, and we'll see you soon.